Hello, KSB community. My name is Marissa Frost. I'm a family nurse practitioner with KSB Hospital, practicing out of the Family Health Center in the lower level of Town Square. And today I am going to talk to you a little bit about the Medicare Part B and their annual wellness visit. So thank you for joining us. The objectives we're going to kind of cover today will be to identify the benefits of the Medicare Wellness visit. We're going to clarify a little bit of the billing behind it, but know that there's a lot more to the conversation than what I'm going to present to you today. We're going to talk about screening and testings that KSB offers, and then also things to talk about with your provider, as well as some resources that are out there for the community. So Medicare patients, regardless of your age, are recommended by Medicare and by your provider to see them annually to talk about wellness and preventative care measures. Those things are something like a colonoscopy screening. The purpose of these visits is to do risk assessments, determine what wellness screenings and tests you're appropriate for, and then to make sure that we're doing everything we can to keep you healthy and safe for as long as possible. Medicare Part B will cover one wellness visit per year. During this visit, you will have several screenings that you'll have to complete. This will be done within the first 12 months of joining Medicare and then annually after that. Your Medicare Part B does not cover the annual physical exam or evaluation and management of your chronic conditions that are already present. That will be billed under your Medicare Part A. At your Medicare Wellness visit, it's designed to discuss and to evaluate your risk factors for developing chronic conditions. Those things are based on your gender, your age, your ethnicity, your weight, as well as your social history and family history. And the goal of this visit is to create a very personalized plan of care and how you're going to prevent these conditions. So some of the conditions and screenings that are available during this visit that we will discuss are diabetes. Diabetes is really important that we identify and treat if it's present, and then also to prevent it as much as possible. So 3.4 million Americans have diabetes. That's 1 in every 10 people. 1 in every 3 people have prediabetes, and there's interventions that we can do to prevent you from going from the prediabetes stage to diabetes. The screening that would be discussed with you at your Medicare Wellness visit is a screening of a blood test of a hemoglobin A1C. This blood test is covered 100% by Medicare Part B if you don't have a history of diabetes or prediabetes. What we can do at this visit is discuss interventions for obesity therapy. We can refer you to a dietitian to discuss diabetes self-management, and then also nutrition services. For diabetes, you can research this from the American Diabetes Association and also the Center for Disease Control. We will discuss lung cancer screening. It's important that we talk about screening for lung cancer based on your risks. Lung cancer is the top 3 diagnosed cancer within the United States and number one cause of cancer-related deaths in the United States. So based on your risks, if you've been a smoker of a pack per day for 20 years or something equivalent to that, and you're over the age of 50, we can do what's called a low-dose lung cancer CT scan. This, again, if it's screening for lung cancer, meaning you don't have the diagnosis of lung cancer yet, then this will be covered 100% by Medicare. The other thing we're going to discuss at this appointment is tobacco cessation. And the reason that that's important is because there's a lot of resources out there to help you quit smoking if that's what your goal is. If you choose to continue smoking or continue to have a high risk for lung cancer, then we'll do an annual low-dose CT scan. And again, that is covered by Medicare 100%. Some resources, if you are interested in quitting smoking, would be the Illinois Quit Line. I'm going to screen you for alcohol misuse. This is going to be completed during the intake portion of your Medicare Wellness visit. It's important to know that over 85,000 deaths per year are associated with alcohol misuse. So we'll screen you for alcohol misuse by discussing your use of the volume of alcohol, the frequency, and then as well as the type of alcohol. And then what we're going to do based on that information is just discuss the interventions, the reasons behind the alcohol use, and different things we can do to help you implement positive interventions within your life. The resources for alcohol misuse would be the National Institute of Alcohol Abuse and Alcoholism. During this appointment, we're going to discuss heart disease and screening for your risk for heart disease. It's the leading cause of death in men and women, and over 20 million adults over the age of 20 have some degree of coronary artery disease. To screen for heart disease, we do an annual blood pressure screening as well as a lipid blood test every 5 years. If you have a history of abnormal cholesterol or abnormal lipid blood test, then it's no longer a screening test and will be considered part of your management and care. So we won't discuss this at that appointment. Things that we can do if we find that you have an elevated cholesterol level and increased risk for coronary artery disease is lifestyle modifications. We can do medication management to decrease your risk over the next 10 years. The resource for heart disease is American Heart Association. At your Medicare Wellness visit for women, we will also be testing for cervical and vaginal cancers. It's important to know that annually 13,000 women are diagnosed with cervical cancer and 4,000 pass away from cervical cancer every year. So we'll evaluate your risk factors for cervical and vaginal cancer and then determine the need to do a pap test or pelvic exam. Your provider can also complete a breast exam or teach you how to perform a self-breast exam. The pap smear and pelvic exam can be completed every 24 months. But women of a higher risk can also have it completed every 12 months. They also can complete HPV testing that's covered by Medicare Part B every 5 years. And that we can do is repeat screenings. We can do procedural interventions to help decrease your risk. And then, of course, discuss with you risk factors and how we can reduce those as well. The Center for Disease Control is a great resource to learn about cervical cancer and vaginal cancers. Colon cancer. It's the fourth most common type of cancer in men and women, and also the fourth leading cause of cancer-related deaths. Colonoscopy can be performed every 24 months if you're very high risk, and every 10 years is for the average person starting at the age of 45. For those of you that are on Medicare, Medicare Part B will cover the procedure costs. They do not cover the anesthesia services. Those are going to be covered under your Medicare Part A. So it's important to understand that a colonoscopy is not going to be 100% covered, but mostly covered. For those of you that have very low risk for colon cancer but are above the age of 45, a Cologuard may be an appropriate option. And I'm sure that many of you have seen a commercial on TV for this option. That's completed every 3 years. So the importance of screening is to notify ourselves and your provider if you have a risk for colon cancer or if there's a presence of polyps that could become cancer. What we'll do is then remove the polyps and perform additional surgical or medicinal interventions to help prevent the cancer from developing or progressing. A resource for colon cancer is the American Cancer Society and then also cancer.org. Depression screening. A lot of our clinics are screening for depression on an annual basis, whether you're on Medicare or not. But it's important to know that 10.6% of office visits have an indication for depression evaluation, and 4.7% of people report regular feelings of depression. Although not everyone who is depressed has a risk for suicide, there is an average number of suicide deaths per year of 45,979. So what we're going to do at your Medicare Wellness visit is we're going to screen you for a history of depression or symptoms of depression. We utilize what's called the PHQ-9 questionnaire. It's 9 questions, and you'll complete that once a year, maybe more frequently if it's positive. And there are many things that we can do to help support you if you have the diagnosis of depression. That includes counseling, medication, and many local resources. Those resources can be KSB Outpatient Behavioral Health, Mississippi Centers, Substance Abuse, and Mental Health Services Administration. If you do have depression with some suicidal ideation, please call 1-800-662-HELP. Also perform hepatitis C screening. We'll evaluate the need for this blood test at your annual appointment. We'll perform this test one time, unless you're high risk, in which case we'll perform the blood test every year. People who are high risk are those that have a history of IV drug use, have received a blood transfusion before the year 1992, or for those of you that were born between 1945 and 1965. If we were to diagnose you with this positive screening test with hepatitis C, there's many things that we can do, such as monitoring your labs, monitoring the function of your liver, and then also administer medications to help prevent chronic issues. Again, the Center for Disease Control is a great resource for this consideration. HIV screening is also available to Medicare patients. It's important to know that 1.2 people in America have HIV, and 13% of people don't know that they have this due to the lack of testing. New HIV infections have decreased by 8% from the years 2015 to 2019, so we know that screening is helpful. So we screen anyone between the ages of 15 and 65 every year if they desire that screening. We also will screen on a more frequent basis if you're high risk. The blood testing is the method of screening. And what we can do is we can treat your HIV if it comes back positive, or help you modify your risk factors to prevent it from developing. Again, the CDC is a great resource, as well as the World Health Organization and HIV.gov. Breast cancer screening will also be discussed at the Medicare Wellness visit for women. Over 264,000 new cases of female breast cancer are diagnosed every year. Women between the age of 35 and 39 can have a one-time baseline mammogram. Then they can have them annually starting at the age of 40. So what we do is we do a mammogram in order to screen for breast cancer. Sometimes when we're screening and we're looking for breast cancer or abnormalities in the breast, it requires us to do further testing like an ultrasound or a more in-depth mammogram. The screening mammogram is covered 100% by your Medicare Part B. A diagnostic mammogram requiring us to look further into maybe a lump or an abnormality, then you will pay 20% after meeting your deductible. What we can do if we identify something abnormal on a mammogram is we can treat with medications, repeat imaging, schedule a surgical intervention, or biopsies. A lot of this is done just to prevent the progression of the disease process. Resources for breast cancer screening would be the CDC, breastcancer.org, or cancer.org. Men will be screened for prostate cancer. It's the most common non-skin type of cancer among men. We screen anyone between the ages of 50 and older with an annual blood test or a digital rectal exam. Men without a history of symptoms of prostate cancer can have this screening as well. What we can do if we determine that you have an elevated risk for prostate cancer is surgical procedures, medications, and repeat monitoring. The goal is to intervene early to prevent it from progressing. Again, the resources are cancer.org or the CDC. Bone density screening is also available for men and women within the Medicare program. 18% of women over the age of 50 have osteoporosis of their hip or of their back. 4.2% of men over the age of 50 have some degree of osteoporosis as well. Who do we screen? We screen every woman and then also high-risk men. So that category means that we screen women who are postmenopausal. If you've had an x-ray of some other bone in your body due to falling or pain in the past that revealed osteopenia, or if you've had long-term or frequent use of prednisone. Patients that have hyperparathyroidism also have a risk for osteoporosis or osteopenia. We do this screening by bone density evaluation. Bone density evaluation is with a scan, like a radiologic or x-ray image, where we look at the density of the bones. So if we find that you have bone density concerns or osteoporosis, what we can do is assist you with supplements, medications, and then also prevent falls that increase your risk for hip fracture or lower back fractures. Men can be screened for an abdominal aortic aneurysm. Over 200,000 people in the U.S. are diagnosed every year with an abdominal aortic aneurysm. Specifically, men who are the ages of 65 to 75 who've smoked at least 100 cigarettes in their lifetime, and anyone with a family history. We complete this test with a one-time ultrasound of the abdomen. If we were to diagnose you with an abdominal aortic aneurysm, we would monitor it by repeating imaging on an annual basis or more frequently, blood pressure control, and then ultimately surgical intervention if it's needed. A resource for information about abdominal aortic aneurysms is vascular.org. Your provider is also going to discuss with you immunizations. Medicare Part B is going to cover an annual flu shot, and then they're also going to cover your pneumonia vaccines. This may be a one-shot series, it may be a two-shot series. Your provider is also probably going to discuss with you a tetanus vaccine as well as a shingles vaccination. Neither of these vaccines are covered by Medicare Part B, but depending on your coverage available through Part D, they can be covered pretty well from your pharmacy. For more information about these vaccines, go to CDC. We're also going to discuss advance directives. It's important to know that advance directives include a power of attorney for healthcare, a living will, and then also a post form, also known as a DNR. We complete this form with you in the office, and the goal is to establish what your goals are for your health now and then in the future. There's nothing worse than waiting until it's too late to make these decisions. We want to help you select the right person in order to make decisions on your behalf in the event that you're not able to. We also want to have it in writing so that we can support that family member in the decisions that need to be made during an emergency. For more information about advance directives, you can visit the Illinois Department of Public Health or call your provider. Following your Medicare annual wellness visit, you and your provider will discuss what blood work is recommended and what you would like to proceed with. Remember, we're looking for the presence of a condition. So if you already have a diagnosis of, say, diabetes or lung cancer, you're not appropriate for the screening criteria. And those will be discussed at your annual or your every 6 month, every 3 month follow-up appointments with your provider. This is a wellness visit designed to evaluate the presence of a condition, not knowing if it's present or not at the time of the appointment. Medicare will cover 100% of this appointment unless it's combined with one of your chronic condition management appointments. There are some caveats to the billing, and so I think that it's really important that we evaluate and you use your resources that's available out there. For more information and details on what Medicare Part B will cover, please visit the Medicare website. You can also download the Medicare app, which on your smartphone, if you select Browse All Items and Services, Preventative Services, it has a list of everything that was discussed here today. Reach out to your family practice provider and schedule your Medicare Wellness and get this year started off great.